Governor, I'm going to start with something personal here. I'm conflicted because I'm reporting on COVID-19. I was supposed to go on a delayed honeymoon next week to Europe.
Yeah.
So I'm up and down. How are you?
Doing fine. I think, I'm sorry you don't get to go to Europe. I'm not really sure what the health reason is for that because we already have it here. So on the other hand, this is a very important story to cover. So I'm glad you're here doing that. I'm sure you'll be able to reschedule. I'm doing fine. I didn't have any travel to Europe scheduled, but certainly this has superseded all the other work we're doing. We set up our emergency response last week. We've been taking coordinated actions, really rolling out something else every day, whether it's helping with the workforce shortage, sick leave for employees, gearing up our hospital capacity, the social distancing. Really every day we're really adding to what we need to do to try to stay ahead of the curve.
Scott Bookman, your incident commander for state public health, said multiple times on Next yesterday that we're beyond the point for mass testing. And today you called for more testing. Why am I hearing two messages from the same team?
No, it's the same message. I mean, we were clear today. What is the purpose of testing? It's to determine whether you can go back to work right after your symptoms subside because it was a cold or flu. Do you need to take those 3 or 4 days off and then go back? Or do you need to wait the full 14 days before you go back to work because it's coronavirus? From the public health perspective, we need testing for epidemiological surveys. We need it statistically. We're getting that. We're doing that. If somebody needs immediate health care, the testing will be done. But whether you have pneumonia or coronavirus, whatever you have, you need the hospitalization. So you need to go in if you're having trouble breathing. The value of the testing at this point is in the general sense, it's nice to know, but more importantly, it just determines whether you can go back to work when your symptoms subside or whether you have to stay out a full 2 weeks. And that's the main purpose that it fills at this point.
So the testing is more for me, knowing I'm ill, when do I go back to work, than it is
If it's not coronavirus, we want you to go back to work after 3 or 4 days, both for yourself as well as for our economy, right? And by the way, of the data we have so far, 9 out of 10 people here who have coughing or fever have the cold or flu. Only 1 in 10 coronavirus. And that could change drastically in the next few days, right? It could be 3 out of 10 have it. It could be 1 out of 30 have it. But based on the information we have from the drive-through sampling and the other work we've done, about 1 in 10 Coloradans experiencing these symptoms have the coronavirus. We want to make sure, again, that those 9 in 10 can return to work after 3 days because we need you for our economy to run, your healthcare workers, your teachers, whatever you do. But that 1 in 10, whoever comes back positive, needs to remain at home and isolated for 14 days.
You want to stop large gatherings of 250 people or more unless they can keep 6 feet apart.
That's right.
What power do you have as governor to mandate and force a business or operation to close?
So there are significant powers. They generally reside with the distributed nature of governance or state with county health. So you've seen some counties like Pitkin County where there's a hotspot go to no gatherings of 50 and up. We support them with that. The general guidance we accept statewide will be the 250 and up. That will be prevented unless there is a method to have people groups 6 feet apart.
Could we have, even under that scenario, could we have another Post Malone concert beyond today?
Well, again, the guidance, and the mayor addressed this in the press conference, is there will not be public gatherings of more than 250 people unless there's spacing protocols that are taken.
The DCPA, the Buell Theater, museums, logistically, they may say, well, we can have people every other row, every other seat, something like that.
That's correct. I don't think they're ready for that now, but this is here for the long term, and we expect that some venues will roll out those measures in the weeks ahead because they want to get back to entertainment, they want to get back to serving people in a safe way. So what does that mean is and I'm going to be talking to the venues later today, but part of what, let's say it's a 1,000 person venue, they may be able to operate, but they may need to have 300 people. Whoever they need to configure it so that the groups of folks who attend are 6 feet apart and it doesn't contribute to the overall contagion. So I don't think anybody has those plans yet. That's brand new, but we're going to encourage all of those groups from figuring out what that looks like so they can return to that before they can return to their full opening.
What about a big box store or a large grocery store? Those have more than 250 people, and we can be crammed in there at once.
Well, that's not a gathering or a crowd. I mean, if you have a large store, or for instance, some people said restaurants, right? They're not going to be closed down. A restaurant the tables, you are, I hope, 6 feet apart from the next table. I mean, that's a normal distance. You're probably 8 to 10 feet apart from the next table. So your group, you got your 4 or 5 people there. Again, it's fine. It's one of the key messages we wanted to send with the required sick leave for restaurant workers, food workers, hospitality workers is they have every incentive to stay home if they're ill. They will stay home if they're ill because they get paid if they're ill. So you have a lot less to worry about than if people felt that pressure to go to work sick because they couldn't make their rent without it.
Ski lifts. Why not tell ski resorts, you're closed, or you can only have 250 or fewer people ski at a day?
Well, that's ridiculous. I mean, 250 people skiing a day, you're talking about huge slopes. So what they are doing, and this is very important, first of all, outdoor recreation is a great thing to do if you have your kids and, biking, hiking, all of those great things that, in the outdoors. They have taken measures and are taking measures to make sure that on gondolas, which are closed, it's only one skiing group at a time, right? If you're skiing with 3 buddies, the 4 of you ride up on the gondola, there's not another group of 4 and another group of 2. Same on the chairlifts, where again, it's your group that goes up, you're not mixing and mingling with other groups. So you're already exposed to your group, you're hanging out with them, that's your 3 or 4 buddies. We're not concerned about that, that's what's already occurring. We want to prevent everybody from being in enclosed spaces for a period of time, and that's exactly what's happening.
If more spread were to happen in situations like that, is there any responsibility for not having shut things down or taking a more you say you don't want the it's Italy approach, you want to be more...
We hope to avoid the Italy approach by taking these steps earlier in the curve than Italy did, significantly earlier. So we feel that on many of these we're acting about 2 weeks earlier. If Italy had taken the steps that we took, we think they could have avoided that spike. Again, this will all be superseded every day by the data and the science that we get. But by taking these social distancing measures, the closures of some of the schools, the isolation for people, we hope that we can avoid some of the more severe shutdowns that we've seen in Italy.
You asked for people who are retired to come back to the workforce, perhaps, or at least talk to
Medical. We're talking pharmacists, doctors, and nurses who are doing something else or are recently retired. Contact your former employer because we might need you during this surge.
Are we lacking bodies, or is it space and the bed space and the testing,
it's both
but
in
not
all.
the bodies necessarily?
Here, we're not lacking bodies currently. We're not lacking space currently, thank God. But we're anticipating this. We're trying to be a week or 2 ahead. Here's why you're lacking bodies. First of all, you have practitioners themselves that are going to be in isolation, and some will even have coronavirus. That will affect the workforce of the caregivers, not because of their professional capacity. They might have just encountered it in the community. You also have many families who, now that schools are out, are trying to make arrangements with their kids, and you'll have health professionals and caregivers who have to take a day or 2 off just because there's no one else at home with their 6-year-old. So we need that surge capacity, and that's why we are making it easier. We're easing requirements on people with licensure in other states to practice here immediately, and we're encouraging people that are in other fields or recently retired to consider making yourself available during this surge.
Would there have been a harm if you would have made any of what you said today, the 250 and asking for retired medical personnel, and more restrictions? Would there have been harm had you said that Monday?
We're taking steps every day, right? So the initial steps were around the nursing homes and the most vulnerable population, right? We also made sure that people 65 and up can renew their driver's licenses online, don't have to physically go to DMVs. You're going to expect a steady stream of actions here almost every day on additional steps. So we start and we focus first on the most vulnerable population and protecting them. We had an initial order as well around sick leave, and also around making sure that people can get 2 months of their prescription drugs rather than 1 month. Again, very important because we don't want seniors unnecessarily going out. You can get 2 months. They don't need to go in every month for their prescription drugs.
What's your biggest fear as governor? This is something, when you were campaigning, floods, fires, mass casualty events, that's happened from previous governors you could learn from. This is all new territory, I'm assuming. What's your biggest fear that you approach both personally and professionally?
Yeah, the last big incidence was 1918 in Colorado with the flu, about a century ago. We did in my first month go through a dry run of a contagion experience, so we've been through kind of the workshop on this. But yes, I mean, I think most people would have expected it'll be a fire, it'll be a flood. That was a more likely scenario. This has ramifications far beyond Colorado, right? There's a major economic impact on the global economy. particularly in Colorado, which has a tourism economy. Oil and gas prices, $30 a barrel, again, might be good for consumers, bad for producers. So there's a lot of impacts that are beyond our control. We're not focused on those. There's global economic impact that's happening. We hope Congress passes a recovery package, and we're going to do our best with what we can here. We're focused on the public health response. First in the country to set up a mobile testing. More than 10% of all the tests done in the country have been done here in Colorado. We feel we have that key few-day lead on where the rest of the country is. We're a couple days ahead of where the country is. The country as a whole was caught on our heels. We're behind. Colorado's a few days ahead of where the rest of the country is.
And have you had any communication with any of the presumptive positive patients?
I talked to the first one we had in Colorado, and I've talked to people in isolation since then. Mostly we're focused on our response. Again, what I want to encourage people is if you have flu-like symptoms, until your test comes back negative, and if it does come back positive, that's the case too, please stay in isolation for 14 days to prevent the spread. And I know that's tough. It's not the easiest thing to stay in your home, but that's exactly what we need to prevent us from having a peak that far exceeds our ability to treat people at our health facilities.
One last thing is if I'm going to the grocery store to stock up on things that I need and I'm standing in line and it's a long line, are you comfortable if you're that person in line with dozens of other people in checkout lines?
Again, I would encourage our most vulnerable population. If you are in your 70s or 80s, if you have respiratory problems, I would encourage, and hopefully your friends will offer this, I'll do your shopping for you and I'll leave it on your doorstep. That would be advisable. For those who are young and healthy, of course you're shopping. You're not near 200 people, you're just near one person on the other side. Let's put this in context, Marshall. Many Coloradans, and under some models, most Coloradans are going to get this, and most Americans are going to get this. The Chancellor of Germany said 50 to 70% of Germans are going to get this. I've seen estimates ranging from 10% to 70%. That's just the range we've seen. For almost everybody, it's going to be asymptomatic or a minor cold. What we're worried about is our most vulnerable population. In Washington State, 17 deaths in a single nursing facility because of the contagion. So again, if you have it, if you have flu-like symptoms, you need to self-isolate for up to 14 days. If your test comes back negative, you can return to work after the symptoms subside of your cold or flu. If it comes back positive, you need to remain out the entire 14 days. Help your elderly and vulnerable neighbors and friends by offering to shop for them and bring the goods to their doorstep.
Thank you.